Hello, everyone, and welcome to RevMD Sex Bites podcast with me, your host, Dr. Deborah Durst. So I have lots of people in the studio with me today, and I'm going to let them introduce themselves. But in the meantime, I wanted to start with the fact that I am traditionally trained. I did ER medicine for a very long time, approximately 25 years. And ventured into anti-aging regenerative medicine about a decade ago, more than that. In the process of doing so, discovered an entire new field of medicine, sexual wellness, which is just untapped. Taboo, people don't talk about it enough, not enough offerings or solutions to patients. And so Revitalize MD and definitely the RevMD podcast, we want to bring those solutions to patients and get it to more people. So if you have any questions, comments, experiences you want to share, please leave them in the comment box. And then in the meantime, I want to introduce my guest. And we're going to have a fun podcast today. So Lori is my first guest. Go ahead and introduce yourself.
I'm Lori Naples. I have been a patient of Dr. Durst and the Revitalize team since the inception of Revitalize MD, and very happy patient in all realms of everything that you do and that you offer. And I'm just super glad to be with y'all today. Thank you for having me.
Hello, I'm Marissa Staten. I'm the medical esthetician and laser technician at Revitalize MD. I've been in the cosmetic industry since 1999 and medical aesthetics since 2009. So thanks for having me.
Hi, my name is Meredith Wallace, and I'm a skincare specialist at Revitalize MD, and I've been with the company for about a year now.
Hello, everybody. My name is Feride Golan-Bieski. I'm a family nurse practitioner at Revitalize MD. I'm the newest one to the team, but very happy to be here and excited to be in the room today with you all.
You have such a fancy name. Mine is boring compared to yours.
Right.
My name is Michelle Silva. I'm a local reporter, news director, DJ, a little bit of everything. And I am a possibly curious patient to be of Dr. Durst soon.
That's right. Michelle is here and she's going to ask questions as a patient would when they're interested in services but don't know enough about them, right? So again, she can direct the podcast and recording today, and she's going to ask us a lot of different questions. Fortunately, Lori is a remote patient, but is in town today, but has had some of the services that Michelle might ask about. And so she can offer up her experience with those services. So I'm going to open it up to you, Michelle. You just ask away.
Well, first of all, when you get to a certain age, I think you start thinking, oh, well, hormone replacement there. And you hear all these different words and long words and OSHOT and Rev, and you don't understand all what it is and what each thing does. And I don't know, I guess, Lori, too, I was wondering what made you go for the OSHOT. And did you try other things?
I've tried just about everything that they offer in the office. I mean, it's just something that we all, go through it. I mean, no matter whether I think you're male or female, everybody goes through changes. And whether you have changes or not, or, I've even had young friends of mine ask about the OSHOT, what's your experience? What is it? Why would I? Those kinds of things. And of course, it's something that, you want to try because of the benefits of it. The PRP therapy is, I love the PRP therapy, no matter how it's used. I've seen great benefits to any aspect of it, and the OSHOT is just one of them. So I thought, okay, let's try it.
Explain PRP therapy.
Okay, so they take and they withdraw the blood, they spin it down, and you get the platelet-rich plasma, the PRP on the top. They siphon it off, and then, if I said that correctly,
I love it.
Pull it
Yeah,
off.
we're
And
We've done our job.
We've done our job.
Everything's set up, and then they just re-inject it back into. So it stimulates your own collagen growth. So it's your blood, your platelets going back in. And I just saw this really plump, beneficial, like in the face, very natural look. But it just, to me, the key word is collagen, right? Everybody wants youth, and it resides in collagen and the regeneration of that. And that's exactly what it does, is over time, it regenerates those fibers. So you get a lot of different benefits depending on where it's going.
You need to do just a video of her and have her up in the waiting room, IV room. We don't like to really utilize it as a waiting room, but like an IV room. Yeah. Because she did a great job of just explaining it. I love it.
Well, it's amazing. I love PRP. It's one of my favorite things. It's one of the very first things that I did at RMD was PRP therapy.
So even when she's like talking, again, we'll draw blood from you, spin it down, and we are basically concentrating the platelets only. And so that's what platelet-rich plasma is, or PRP. So now we have spun it down to the point where we're separating out the red blood cells, the white blood cells, and we just get the platelets. And then platelets have a ton of growth factors in them. And so Lori's correct in that if we injure our arm, the platelets go to stop the bleeding. But then now you're regrowing arm tissue over a period of like 3 weeks to 3 months. You get that healing. And again, the younger we are, the quicker the healing process. And the older we are, the slower the process. So between 3 weeks and 3 months, we might be talking about closer to 3 months. You still have that little area that's healing. And when you were 20, it healed like that, right? But basically, you're regrowing. So those platelets with growth factors are communicating with the stem cells in an area to regrow whatever's in that area. So whether it's hair in the scalp, collagen and elastin in the face, and, the vaginal canal, clitoris, all those places. So we can inject it anywhere. It's magical in what it can do to regenerate your own tissue. So again, more naturally youthful. And
I feel like you hear a whole lot about it, a little bit more even so too in orthopedics and areas like that too, before hearing about it more in the aesthetic world. People do, orthopedic surgeons, nurse practitioners do injections of PRP in knees, in ankles, in back, anywhere too.
Tendons,
everywhere. Because it has such an awesome capability, which I've done it multiple times. But in the aesthetic world, I feel like it's a little bit more newer, and now it's becoming a lot more prevalent too. But that's kind of
dental too, right? For receding gum lines.
I think so. They're starting that as well. So now everybody's kind of catching on, and
actually, it was in dental and orthopedic before it was anywhere.
Really?
Absolutely. So we're talking about our own body's production, right? What else is better than taking something from our own body to fix and repair what has happened with aging to our bodies? So we're not looking outside. We're not pulling more traditional medicines, more pharmacologic medicines. We're going right back to the source ourselves.
And that's done all at one visit, or is it over a period of visits?
Well, it depends on what you're getting done. So like basically the O shot is one visit, but we'll always pair that with lasers, or, there's a couple different lasers we have. So again, depending on what kind of results you want and what your history is. But a lot of times we're pairing that O shot or PRP procedure with something else, multiple modalities to correct it. So when Lori's talking about facial, again, like the vampire facelift and facial are PRP. So again, drawing blood, spinning it down, getting the platelet-rich plasma. If it's a vampire facial, we're just microneedling and putting it on top to get into the holes to stimulate collagen and elastin. If it's a vampire facelift, then we're injecting it with a little bit of filler. It's a little more, a little more comprehensive a treatment, because we're doing a little bit of filler and then we're injecting PRP. But the results are amazing in the collagen elastin that you form, the glow to the face after, the volume that you create on your own with just a little bit of filler. And people love the vampire facelift. Not exactly what we were, starting off with as a conversation today. But again, we can inject PRP anywhere.
And I've had both
it's
of
amazing.
With tightening and brightening.
Tightening and brightening. Love it.
Now, is there anyone who's not a patient for that?
PRP, there's like actually no side effects with PRP. You're using your own blood to repair. Of course, could we get bruising or pain or like maybe a little swelling or seroma or something? Yes, but no side effects. And no one that's not a candidate. When we're talking about pairing it with, like, if we're talking about lasers with O-shot, then there's some people that may not be a candidate. Depends on your age, what your surgical history is, if you've ever had children. But as far as an O-shot injecting PRP, there's no one that's not a candidate for that. You can do it. It's magical what you can get from your own body to repair. In a face and scalp, and again, P-shots, O-shots, which is maybe something. that you're interested in hearing about. I know a lot of patients are, so.
And how soon did you see the difference or notice a difference?
People are different. It could be some are immediate. People have that effect, but then there's also where, depending on where or what, it's, over time, like she said, it could be a couple weeks, it could be a month, when you really, it just depends. It's the person and, what's going on already in their body, depending on where where it's been.
And I typically say 3 weeks to 3 months when we're talking about regenerative type procedures. So I always say if we're regenerating and we're giving your body back what it needs to repair, I always say it starts at 3 weeks to a touch point. So if we're doing a procedure, 3 weeks it'll start, 3 months will be like the completion of that effect. So sometimes we're doing a series because, again, before it starts to wear off, we're hitting it again with another treatment, of PRP, whether it be the scalp or the face or microneedling, vampire facial. And sometimes like with an O shot or more of the sexual wellness and PRP, again, 3 weeks to 3 months, they'll know for sure because it's awesome at helping with urinary incontinence and works very well with a laser treatment for urinary incontinence. If it's an orgasmic, then again, it may not take quite, the amount of treatments. And so some people with stress urinary incontinence might need 1, 2, or 3 O shots, for instance, depending on the severity. But once we get you there, usually I would say about a year people are repeating a treatment after we've done a series and got them to where they want to be.
I will say also the immediate, I think, is more because of the plumping effect, because you're putting that PRP back into the tissue. So there's a plumping effect to it immediately. So you could get sensation from that or the look of that. But then over time is whenever it's actually that collagen building, is part of that.
Something more sustained, you're saying.
Yes, exactly. But I will say, I think you told me it would be anywhere like up to a year, possibly, but mine lasted way longer. Mine, no matter what it was, I don't know, maybe a year and a half, almost 2.
That's promising.
Yes.
Yeah, I mean,
Yeah.
but it really did. I mean, that's straight up. For me, that was my experience with all of it, which I'm glad.
Wearing off too fast before they got to enjoy it.
Yeah.
So I don't think there's anybody in here that hasn't had
and a half.
PRP in some way, whether it be like a vampire facial and PRP application on top of, and so it's time. Right?
You look at me.
I know. It's time, huh?
So let me ask you, what has held you back? Is it maybe the pain thought of possibly? Would that be I mean, that's what I've had a lot of people ask me. Was it painful? No.
No, I'm just learning all about it.
Yeah, I was gonna say she's just
I've
learning.
never even heard about it until I was
Yeah.
introduced to Dr. Durst.
Yes,
actually, and that's why it's a whole new world to me.
Yeah.
And
You
like I
met
said,
the right girl and the right people.
so I know I'm still like as far as the O shot and exactly how does it work?
When we're doing the same thing, so it's PRP, so we're drawing blood and spinning down blood and spinning it to get just the platelets. And again, platelets have growth factors, so now we're re-injecting those growth factors into the clitoris and the vaginal canal. So anterior vaginal canal specifically, because again, it's the anterior vaginal canal that there's a space between that and the urethra. And so typically if people have had childbirth, just the pressure of a pregnancy can obliterate the space in between the two, so you don't get support of the urethra, so you'll get urinary incontinence with it. And so again, re-injecting those growth factors into that space, get increased collagen and elastin, support of the urethra. So as far as women, surprisingly, a lot of women will get effects immediately and never have incontinence again. I never like to state that as an expectation because I feel, again, it's a 3 week to 3 month. That to me makes more sense science-wise. But whether that space just holds volume and creates like a space where the volume's supporting until the growth happens, because a lot of women will never have incontinence after that first one, but some might need 1, 2, or 3, depending on, again, the severity of your incontinence. But sometimes, again, it's not for incontinence. Sometimes it's for decreased orgasmic strength, which is going to happen with age. So as our hormones decline, that tissue isn't as healthy. And what happens with almost every woman after childbirth or age or hormonal decline, but at some point we have decreased orgasmic strength. So even if you've never had children, you still have decreased orgasmic strength. So it takes you longer to achieve orgasm. And I don't think any woman beyond 50 is going to kind of argue that that hasn't happened. They may not have openly sought a solution or talked to anybody about it, but I think if we're honest with ourselves, that happens. And it's just taking us longer. We're not as, turned on, we're not as aroused, not as lubricated. And again, orgasmic strength is, and again, if like it's a couple that's been together for a long period of time, sometimes the guy is the opposite and needs to, move through it a little faster because he's not sure how long his erection will last, and then we need a little bit longer. So it's a mismatch. And so our job is to bring people back together. We're also injecting it not only into that anterior vaginal wall, but into the clitoris, because the clitoris has legs on the side of the vaginal canal, helps with orgasmic strength as well. And so we want to enhance the clitoris, make that more prominent, collagen, elastin, but also the PRP and growth factors increase blood flow and nerves.
So we've talked a lot about like you had mentioned, at a certain age, but it's not just older women. Myself, I've had 2 children. I mean, I don't know about you ladies, but if I get on a trampoline and jump with my kids, who knows what's going to happen, right? So supporting that urethra and helping that urinary incontinence, I think, is huge. And I don't think that's something that we talk enough about. I think that younger women tend to not think about these type of treatments, where as we get older, like Dr. Durr said, there are changes that become a little bit more obvious. So we start to seek a little bit more. But definitely there is the other side of that on the urinary incontinence side that younger women will definitely benefit from too. Even hormonally, there are changes in younger women, even as early as, late 30s. We can see that where we have decreased orgasmic strength and it takes longer to achieve orgasm and to find that. So I definitely think that it's not just an older woman problem. It's an all woman thing, right? Like I said, I don't know about
Just
the other ladies
that don't
here.
talk about it.
We just don't
Right.
talk about it.
What's embarrassing, right? I mean, I wanted to actually speak to that too because I've never had children. I'm a Pilates instructor, and I found out maybe 3-4 years ago at a training that a lot of yoga and Pilates instructors have issues with incontinence because we've been lifting our pelvic floor for years. So after 8 years of doing this, it's like it's the exact same thing as a lapsed pelvic floor. It's just in the opposite direction.
It's reverse, exactly.
And you need that diaphragm down there to be able to go both directions. Well, mine was too tight, and I would say 3-4 years prior to the O shot, that was an issue, And so now the O shot has helped that too. So that's a lot of times I hear a lot of, people that, women talking about childbirth and that, but then there's others out there that haven't had childbirth, and then we have these same issues, but I never knew that was out there, right? You don't think of it that way, but it is. It can be both. You may not have any children,
From that
right?
perspective,
Yeah,
it could
it's
be
a different
like
total
power
perspective.
lifters,
Yes.
people that have been like lifting weights heavily for a long time and actually doing lots of like mobility movements and things like that.
Yeah.
And just
I think
people
it's
that
a
have
little
lifted weights.
piece of the pie that people don't
Right.
don't know,
And
but it's
especially if
important.
you're in your 20s, like nobody's gonna talk about this. Like everybody in their 20s
Oh,
are way
no, I
too
would
cool
lie.
to talk about.
I would have said
In on
my
themselves.
friends and lie.
Nope. So
Yeah, I just thought it was
It's-
important to
yeah.
kind of bring up, because
People don't want to talk about it. And then, but again, even people that are lifting or competing or, very athletic, but have had children, and now with, that activity or having, stress urinary incontinence of any, of any severity, is more than they want. And younger are, I think, getting a little more open to not accepting even a decreased orgasmic strength. Because if you think about it, you have the vaginal canal, the urethra on top of it. And so the weight of pregnancy is obliterating that space, doesn't support the urethra, so you get incontinence. But the G-spot is in that area too. And so you have obliteration of the blood supply and the nerves to the G-spot. So decreased orgasmic strength happens with pregnancies and vaginal deliveries. And so I feel like at least younger women aren't, like they're not tolerant of losing that in their 20s and 30s, where if we did, we were more and we didn't speak about it as much. So definitely becomes a perimenopause, menopause issue, but can also become an issue that people are more willing to speak about in their 20s and 30s too. So, And then we do the, clitoris injection too. So it's like we're doing into the G-spot in the clitoris. And so, again, probably the more common question when we say that, because it sounds awful, right?
It does. It sounds painful.
I see that
Should
look
I have
on your
childbirth
face.
or
I see the look on her face. Did you see the look?
I know. I'm
If
like,
you can
ow.
only see the look, she's
G-spot.
like,
What?
yeah. So, well, Lori can talk a little. I mean, of course, I've had them.
It's a difference between a female physician and a male physician too.
Yeah.
Mm-hmm.
Yeah.
Right.
Yeah.
You start with the lidocaine, so you're topically numbed, and then blocked, which the lidocaine helps with the block. You feel like a little pinch maybe here or there, but not. But then other times I felt nothing, and then ice. But then you don't even need the ice. I don't even think. So you really don't. You just really don't feel like what you would think, right?
Yeah. So we do a
No.
topical numbing, and then we also do a lidocaine injection as well to further numb. And then we use ice as well as a third option just to kind of help.
The layering of all those.
Exactly.
Yeah.
So the women that we have seen in the office say, that is nothing what I thought it was.
Yeah.
Why did I
Yeah.
let that stop me?
Yeah.
That was
why did I
nothing.
wait so long?
Why did I wait so long? Exactly.
Out of all the procedures we have, even from an aesthetic standpoint and upkeep, and it's way less painful than some of the other aesthetic procedures we do that are done every day. So it's not painful. And again, we will do a topical and that kind of numbs, and sometimes you may or may not feel numb with it, but it still helps numb the area, even if you're not feeling it down there. And then we end up icing, and then we'll block. That block also affects the intervaginal wall or G-spot area. And again, the G-spot area is a sensitivity area different than other areas, but most people do not feel anything beyond maybe a slight pinch with the lidocaine, and even that's unusual. So
Maybe
surprisingly,
pressure, little pressure.
maybe a little bit of pressure, but most people it's a 0 or 1. Surprise, and no one's going to believe us until they have it. Just so you know.
Right.
It's like no one will believe. So even she's
So put it this way, you can do an injection into the G-spot, and that sounds terrible, like she's saying, but most women have no idea you've even done the injection. Like, are you done?
Yeah.
Girl, I'm done and out.
And
What are you
I've been
talking
for
about?
many
We're over.
treatments, and I'm like,
You need to get up out of there.
Yeah.
Well, I'm one who almost faints when they have to take blood from me, so that's why I'm always.
Well, we know one or two of those.
Yeah,
I'd be laying
there
there.
might be a few in this room.
But might be one in this room, but not sitting at the table as well.
Not one of the females.
Yeah.
in the room.
Just saying. But no, even then, we've had that with men with P shots, and it's the same thing. Everybody's going to be nervous, but you don't have to be. But you're not going to believe that until you're done, and then you can. But Lori's had it, so she's had 3 of them now, and so almost a little bit again over a year in between, each one, but has had 3 and is still talking to me, right? So,
Right. And talking to you about it, saying, do it.
Yeah, really, you should,
I guess how has it improved your life the most, or changed?
Well, again, my biggest thing at the time was is the incontinence, really, at the time, that we actually talked about it, and she's like, you should have this O shot. I said, okay, well, the same thing was like, oh geez, I just don't know about any needles going anywhere near that area. Forget that. And then the more she talked to me about it, I'm like, okay, well, maybe, And so that to me was huge, because nobody else helps you. I went to my gynecologist and I said, look, I'm having this issue. And she's like, oh, it's your age. And I'm like, I have not had children. I lift my pelvic floor every day for the last, at that time, 7 to 8 years. And she was still telling me that it was my age and my hormones. And that I was just disappointed, and it was just I wasn't getting anywhere. I wasn't getting help, and so this was one aspect that that just came to me that said, okay, well let's try this, and that was huge for me. because
Didn't you even have a
Coming from the master
conversation
of
with
Kegels, right?
Yeah, I know.
what's that?
It worked.
The master
The
of
master of
Kegels.
Kegels.
I could
Saying-
talk and literally it's clear up here. I can hold, and I have to stop doing that, but what were you going to say?
So you
Dr.
can say Kegels forever, right?
Right?
Yeah.
And still.
There's
But the O-shot doesn't,
Yeah.
right?
Yeah.
Well, and I felt that it was kind of sad. I was in
Kegels.
training and, the lead instructors were telling us that there was an issue. And I'm like, yeah. And then you'd see more heads around the room like, yeah, me too. But, you're supposed to be the master of Kegels. Well, there could be too many in life. And then you're in the same boat. So you have to, again, that diaphragm or that pelvic floor, that diaphragm, the pelvic floor has to be able to go both ways. And it's
So
like
being able to
you have
individualize. So not just the same answer for everyone. Like, hey,
Right,
listen,
yeah.
your
And that was
hormones
the
have
same
declined, and this is what you're going to
Yeah.
experience, and
Yeah.
that's the end of that.
And
Because
accept
again,
it. It was like, and accept it.
because traditional medicine, and she can actually go into this again. I can, drive this point home all day long and tend to do exactly that. Is that in traditional medicine we have surgeries and we have medicines or nothing. Those are our options. And so, our nothing with this is Kegel exercises. Do more of them. Do more of them. Do more of them. And yet we continue to present with the same complaints that we're still having stress urinary incontinence. It's obviously not improving it. Surgery is an option, never going to regenerate anything. So you might lift, and people have, had mesh in the past with mesh issues. They don't have resolution. They don't recover right because, again, we're of the perimenopause, menopause. Now, all of a sudden, our solution is surgery, and we're not healing as well. And then you have medications that might help or might not help. But there's nothing that you can do in traditional medicine that will regenerate tissue, like your own body's repair or increase collagen, elastin, make the tissue healthier. Because even when we're talking about laser, we're like heating the whole vaginal canal so that we're getting stimulation of collagen and elastin and making the accordion, used to be accordion, now PVC pipe as we get older, more healthy to, like, again, receive everything it should receive. And so, again, we want collagen, elastin. We want, healthy vaginal tissue, increased nerves and blood flow to the entire vaginal canal, the G-spot, the clitoris. And so there's no other way to do it except regenerative procedures. And then you even brought up the fact that you had these procedures done with your OBGYN, correct?
Yeah,
And what was her
yes.
response to that?
Not real supportive. I was kind of disappointed. I was very disappointed in, because I found it, wonderful. And, I thought, okay, it's good to share with her. Why not? I mean, this is what she does, right? And I was just very disappointed, in that. And then another chat you need to have is on Votiva for women who have had children, because that's definitely, it works. It tightens everything, and it works. So so that's another
Which is a
another
laser
day,
that we
but
usually pair with the O-shot.
And so depending on what your circumstances, again, I love Votiva and pairing it with the O-shot, and they work so well synergistically, except in Lori's case, for instance, it is going to hit the pelvic wall. It's an RF laser device.
She didn't need it.
It doesn't ablate. It doesn't ablate tissue. It doesn't take tissue off, so it's safe. It's heating, collagen and elastin stimulation. Again, nerves and blood vessels, but it is going to reach the pelvic floor. And so if it reaches that, it's going to make those muscles more tight. That's what it's doing to support the urethra. In her case, she didn't need that. So somebody that may not have had children, it may not be necessary, but definitely once you hit perimenopause and menopause, it's still necessary. But again, taking every individual case, if she's Pilates, her pelvic floor is tight, now we're going to tighten it more. Those are, lessons, again, to individualize care and what somebody might need as a treatment plan and option. And so
still got the
Because
benefits.
too tight is just as bad as too much laxity,
Yeah.
right? So again, individualizing what
Finding
the
the
patient
right.
needs, actually listening, understanding exactly what they're saying, where they're coming from, and where that need is, and then making that plan for that patient on a one-on-one individual basis is huge. Because Lori doesn't need Votiva, but she needs an O-shot, girl.
So tell us about your orgasmic strength now.
Absolutely.
Stronger. I never had issues that way, but it's definitely stronger and more intense, more in every way possible.
Even lubrication.
Yes, lubrication. It's increased all of those things. Okay, so like I said, even if you don't have issues, younger, it doesn't matter your age. It's going to
Who
increase
doesn't want
all
better
of
orgasms?
those. Right.
More orgasms, please.
Yeah.
Right?
More orgasms. Stronger orgasms.
Stronger
Yes.
orgasms, please. Sign me up for all of the above.
More of them, longer, stronger, more in every aspect of intensity, all of that.
So you can do PRP as
aroused.
part of your
Yes.
O-shot, Michelle.
Yes.
We'll do PRP underneath the nipples too. Because
yes.
it will
She's
increase nerve.
Am I going to be able to sleep at night?
Yeah, you might not be able to
Yes.
sleep. You'll be like,
Because of the O shot and all of
Prep
its
yourself.
benefits.
There's no better time to be a woman than right now.
right? She's like, they're bad enough as it is. You're going to make them worse. I won't even be able to sleep. I know. But it does increase nerves and blood flow to the nipples. And so anyone that's had surgery would decrease. But breastfeeding is another one. And again, just hormonal decline. And who doesn't need better sensitivity and turn on with nipple stimulation with PRP? Because again, you're just using your own blood. There's no complications with it. Outside of the fact that if you've had breast implants, we just are, injecting.
Very aware of that.
Very aware of that, and injecting, not anywhere close to the implant, but it's significant at increasing sensitivity after surgery and breast implants, because a lot of women will lose sensitivity. And then just, again, breastfeeding, hormonal decline, age, all of that. So it makes it better. So we can do that at the same time, which is awesome because you're hitting every area. We actually have another laser that we use for clitoral kind of rejuvenation. That sometimes we'll pair with one of the other ones, because typically we're doing an O-shot with a Votiva, then we're continuing on that laser once a month for 2 more, so a total of 3. But we can always add on the clitoral, which is, again, it's a different device, but is using the laser to use heat to bring stem cells to the clitoris and stimulate collagen, elastin, increase nerve and blood flow, and so better, again, orgasm. I love the Fotona clitoral stimulation treatment.
It's 4 minutes to better foreplay.
There we go.
That's actually
That is amazing. All right, there's the new tagline.
Yeah,
Write that down.
Yeah, no, that's the first I heard. Marissa, I love it. Look at yeah. Yeah,
No, it
that's
sounds
perfect.
like what woman would not want to get this done then?
Yeah, no. There is actually, I don't think any woman that should hesitate
Why
to
not?
get these done.
What would the
You know.
setbacks be then? Is it cost? Is it just one of those things that people just haven't heard about it?
So I think the biggest setback for women is believing they're worth it. Like that's the biggest setback for women, by and away.
And not prioritizing themselves.
Not prioritizing
We're
themselves.
nurturers by,
It's the truth.
we tend
Like
to take
every-
care of everybody else but ourselves.
We don't,
Yeah.
my kid needs this more than I need this, so they put it on the back burner until
Because there's a cost
10 years has
affiliated-
passed.
Yeah, with anything that you want, and so again, we'll do so many things for our house, for our husbands, for our partners, for our kids, and then we're the last. And so I think it's just a matter again of like believing we're worth it,
I
and
think it's awareness too.
awareness too, for sure.
How often do you
Education,
hear about
awareness.
this? You don't,
Absolutely.
unless you find, the
I agree
the
with
right
you.
And it's
avenue.
a little bit taboo to talk about orgasms, I mean, especially for women. But I do think that it's a little bit of all of those things. But I think with women, we tend to put everybody else but ourselves first. And like Dr. Durr said, we're worth it. Why not? Why wouldn't we?
Yeah.
I agree.
I think that, so again, those, education, people even knowing that it exists, because you're not going to get those solutions when you go to your regular doctor. again, regenerative medicine is different than traditional medicine in the fact that you are going to get answers that you don't get in traditional medicine. And it's also not a one and done, set free, start a medicine, never take them off. Surgery, how are they recovering? What else can we add to it? It's surgery. You're handed over to the surgeon. Your surgeon will follow up just to make sure wounds are healing, right? Mm-hmm. But if you're not getting results, what is the end result? And it tends to be that if surgeons have continued problems after, they get pretty impatient at answering those requests for something further because that's what they had, right? Mm-hmm. That's we did what we have as a solution, and then it's medications, and so it's never one and done. So there's like regenerative. There's no end to really what you can do. It depends on, again, time commitment and money. But if one O-shot improves it and a few laser treatments, then great. But maybe if you had severe urinary incontinence and maybe you needed 1, 2, or 3, but once you get there, then it's a maintenance of once a year. So education, knowing that there's something non-traditional that you can seek and that's and in touch with, like a provider that's providing you solutions to your end result that you want to obtain, not just one appointment or 2 appointments or once every 6 months we're touching base. And then again, knowing we're worth it. Like that, again, because it's not objective with men, you can see their erectile strength isn't what it used to be. Everyone in the room knows it, right? And so, but with us, we only know it, and they only know it if we talk about it. And so, I think just having that conversation, that taboo conversation, seeking solutions because we know we're worth it, and knowing that the solutions are available.
And I think we
those were all
also,
good points, yeah.
we go to our physician seeking, these fixes that we don't even, how do I do this? What's going on? And when you go to that physician and they're not giving you any kind of an option, it's just like, oh, it's your age or it's this. And, that's the person. That's your sex doctor, right? Is your gynecologist. And you go there and you're not really getting any answers or any direction.
You're getting justification. You're not getting solutions.
Right. Mm-hmm. And, you're looking for answers and there's not an answer. So how many women go to their gynecologist and get that all the time? Most everybody.
Absolutely. I was one.
Most everybody. Right.
Yeah.
So,
do more Kegels.
Right.
I can't do anymore.
Right. Yeah.
I don't want to do anymore.
I mean, come on.
No. And I knew what it was. And I even said,
this isn't working, right?
I said,
and then I'm not going on a medication.
I lift my pelvic floor every day, and that was that part of it. But yeah.
Well, and how did you hear about the O-shot? And
through Dr. Durst. Mm-hmm. Yeah, through Dr. Durst. And again, you have to. I think more women are seeking out these types of things, because social media is huge and everything's on social media. So people find out more there than walking into their physician's office. Mm-hmm. Yeah. So I just happen to be fortunate that she's in my world. And I just hope that more people listen to these podcasts and get this information because you guys are amazing. I mean, this office is amazing.
Thank you.
I mean, it's comprehensively everything.
And there are comprehensive solutions. Like it doesn't have to just be the O-shot, and it doesn't have to be laser and O-shot, but again, hormone optimization. There's other things we can use even from a hormonal standpoint that might be more vaginally driven. There's Cialis low dose you can use for anti-inflammatory, increased blood flow. There's so many different things you can do. Amino acid shots that improve sex drive. There's IV therapy that improves sex drive. So there's so many different aspects to it. And then I think, again, being in touch with a group of women, like here locally, we need to do, more of again, we started that pre-COVID where we were doing a wellness series with women, but even just groups where we do more, educational stuff. So,
where
but
you feel free and
whole body,
to talk about it all.
Where you're kind of pairing it all together to make a total body wellness. And dealing with exercise and mental health and the HRT part of it, and then the treatment aspect of it, and follow up, and all those things that tie in together that it can't just be targeted from one, right?
And it's never one thing. There's never one thing that fixes anything.
And there's always other things that tie to whatever the issue is too, typically.
The nice thing is you guys offer all of that.
Right.
Absolutely.
That's the great thing. You offer all of that. So, and it's patient specific. So you have all these different things that people can do
Comprehensively.
There's always more than one way, right? Multiple
and
modalities that we can use and in
You
our
need
arsenal to pull out as needed based on what is going on with the patient.
And it sounds like the technology and everything that you are, I say technology because we are talking lasers, and we're not talking about foreign substances being put in your body and everything. It just sounds, just so natural. So it sounds like something that you would only see or hear about in the larger cities, like maybe Atlanta, maybe Nashville, but like LA. But this is Knoxville.
Yeah, I know, right? Well, and so again, we're going to another conference at the end of May, and actually beginning of May. It was actually at the end of January last year. That was like that pre-COVID thing. So anyhow, but I was there, and a lot of California-based businesses. I'm just going to keep it very general at this point. Businesses in this industry not doing sexual wellness at all. Like, I'm not saying that there's not, but the med spa industry out there and on the West Coast, you would think were doing more of it, but I didn't see that there.
They wouldn't even talk about it.
Yeah.
Wow.
It was strange.
Yeah.
Very strange.
A lot of the physicians not on hormones, not understanding hormone optimization. So a lot different than I thought it would be, honestly. And so I do feel like it's an odd, very comprehensive offering in Knoxville, progressive. I feel like patients are more progressive in this area than physicians and providers. They come in more educated because they've learned about it. They know what works. And again, if you look at O-Shot, you look at Votiva, you look at P-Shot, Gainswave with men, there's lots of things on the internet and everyone very happy with the treatments, but doctors not willing to go outside of traditional routes to get them solutions. So that's where I think it's a little more hit and miss, depending on whether you have that physician or provider that's going to go ahead and go outside of the traditional medicine arena to really give you different solutions and more comprehensive. And so I would argue that a lot of large cities are just starting sexual wellness kind of sprinkled into whatever they have already going on. I will say that I think we more comprehensively address like full body, whether it be aesthetics, wellness, sexual wellness, so that it all ties together, right? If we start to feel better, then we want to look better. If somebody comes from an aesthetic standpoint, but they're of perimenopause or menopause, they're not going to get sustained solutions and results if we don't hormonally balance them too. So it kind of just more comprehensively fits. And so I think Knoxville might be the starting, like maybe we're just now epicenter, right? Like, what is it? Ground
I think
zero
that,
for it.
that comes from your passion, though, for it. You want to make people feel better. You want to make them look better. You want to make them more happy. That's vibrancy in life is what life's about.
And I think
that's
a lot of like offices and providers love that idea. I just think it's a matter of like seeing all the different pieces pulled together to more comprehensively do it. That's where I think some of it's missing,
and
right?
getting outside that box, right? So traditional medicine, when we're talking about surgeries and pharmaceuticals, it's a very nice little box we learn in school. So to step outside of that box and go after that information and see what's out there for our patients and what natural alternatives there are for them and all the different modalities we can use, you have to be willing to say, okay, this is what I learned, but there's a whole world out here and I'm going to go find out about it and I'm going to learn it and I'm going to master it and then I'm going to bring it to my patient population and make them
you have
feel
that
great.
same passion.
We're going to make them feel great.
You guys
We're going to
are a
make them
great
feel
team.
great based on so many different avenues with their own body, with their own natural, we're pulling your own blood. You're not going to have negative side effects from your own platelets. That is your own body working to fix yourself. We're not taking an outside medicine that has 50 possible complications and giving it to you. So I think
indefinitely.
Indefinitely, right? I mean, you're going to have some side
With
effects.
side
What medication
effects.
are you going to say, oh, I took this and everything was perfect? No, usually there's always a side effect when we're giving you a medication. So I think that, yes, we're Knoxville and we are the smaller community compared to LA and New York and Miami and these other big cities. But there are physicians in Knoxville that want to do more. do it better. And that's really where we come from and where we stand to
we
do
have
it better.
a lot of remote patients. But again, I think if you're watching this, you have questions, you have experiences you want to share, by all means, share them, because we're willing to deep dive into anything, sexual wellness, aesthetics, wellness, or sexual wellness, but definitely anything you want to discuss. And I think the issue is taking something and comprehensively tying it together. And I think that, Revitalize MD does a great job of that, because there's so many different options. And again, being used to being like the one, or like it's a processionary caterpillar, basically. If you step outside of line with traditional medicine, you're almost guilted and shamed back into line. And so again, it's just like staying the path, because we only learn so much, and we still don't even talk about sex much in traditional medicine and education. And so we need to open those conversations. We need to have physicians more able to talk about sex and talk about sexual function and, changes that happen and solutions that are more comprehensive. Because again, one of the big questions that we have is, are things FDA approved? And so all devices are FDA cleared and approved. Physician treatments aren't FDA cleared and approved. That's just, physicians are able to educate, learn techniques, and do it, and it's not an FDA approval process. It's an individual physician trained. So you basically have to find somebody you trust, find an office that you trust, that you feel has educated, has done this. We train other providers to do these procedures that we're talking about. You just have to find that, because it's really not an FDA approved, like medicines and surgeries and, devices you implant like mesh, it was FDA approved and pulled off the market after. So obviously
Complications.
we just want to try more natural ways to improve function. And there's no other way that you can improve and make tissue healthier than with regenerative procedures. So we love them. So again, if there's anything you guys think we missed right now before I close?
I think they found the place to find all these things now, didn't they?
Yeah, I think so. Yeah.
Revitalize
Yeah.
MD.
Absolutely.
Tennessee.
Absolutely. Well, again, and we do see remote patients too. So actually quite a few remote patients. But if you have any other questions, concerns, topics you want us to address, or any experiences you want to share about the O-shot, lasers, you're an instructor or a workout fanatic and you have some pelvic floor issues, anything, we're willing to deep dive into anything, sexual wellness, aesthetics wellness as well. So just let us know, like, subscribe, hit the bell. I want to thank everyone for coming today and it was fun. We had a lot of input and liveliness. And again, we probably will after it's over. But anyhow, thank you. We want to get the word out to more people. And again, we're here to revitalize your look, your health, and your sex life. Thank you.